I think wearing a mask is almost an act of love for those who can't or for those who are immunocompromised. So when I am not working in the ER and I'm out where I'm going to be in close proximity, or I'm going to like or talk, because you
Right.
can talk. I wear an N95 because I do not want any of my particles getting to them. But just if you can and you're able to wear a mask, it's not about like we're not getting into politics here. It's
Right.
literally showing an act of love,
Hmm.
and people get very heated about this. And I'm not a big deal. It's just we don't know enough about this virus, but we do know that it's weird because you're healthy for so long and you're asymptomatic, but your viral loads are high.
Thank you for joining me for today's episode of The Midpoint. I have the pleasure to speak with Dr. Jennifer Flagar, who works as an ER doctor and also runs her own integrative medicine practice. She is here to share what she sees from diverse sides of the human health, from the emergency cases in the ER to the importance of immune system and daily nutrition. Hi, Dr. Flagar. Thank you for joining me for this episode of The Midpoint.
Hi, thanks for having me. I'm really excited.
Awesome. We're glad to have you. So we know that you're a very busy person. You are an ER doctor, and you also run an integrative medicine practice on the side. So it's really interesting to see that combination in terms of the crisis these days. Really interested to know what is happening in terms of the ER and in the hospital. What has the situation in the hospital over the last couple of weeks been like?
Well, it's definitely kind of been a roller coaster because Toledo in general has not been a hot spot, like New
Hmm.
York City, let's say. So you
Right.
hear front lines there because we all talk, colleagues try to help each other, especially in ER. We always do that. And, you're hearing from the front lines in New York City. And
Right.
first we heard from Seattle, like long time, like how to treat these patients, what to do. This was something that we've never seen from a respiratory standpoint before. It just doesn't behave like usual viruses. So it's been, kind of interesting. We kind of all ramped up. Everyone was studying the papers, making sure we were prepared to treat our patients the best. And then
Mm-hmm.
we just waited. And while we were waiting, the ERs were actually not busy. It was like the calm before the storm. And a lot of my friends and colleagues have experienced this. And I think it's been hard on, physicians and providers because the volume has gone down a lot. So actually, shifts have been cut back, in the areas that aren't a hot spot. So it's been very interesting. We're all prepared for a surge, but if it comes, but at the same time, this is awesome because it means that we were all mitigating so well and flattening the curve. So I don't see the negative, I see it as a positive. But yeah, it's been kind of weird because we're slowly starting to pick up again in the ER. But for the last couple of months, it's been odd because sometimes you'd be sitting there and you're like, it's so quiet here.
So there has been some preparation behind the scene. I think in terms of Ohio, especially, we've kind of acted before some of the other states have in terms of mandating staying at home, and in particular with the hospital. I mean, we've seen some in other cities like lack in PPE, protective gear for our frontline workers. And so, was that something that you guys had to kind of go through processes and obtaining that gear?
Yeah, so every hospital system kind of has a different way of handling it. So I've been really impressed where I work. We've always had PPE and I've always felt safe, but we are more stringent about it. So we have like a little bag that we put our PPE in and you use it for a couple of shifts, especially the N95s. You're not going
Right.
to toss those where it's crazy where before if you had a patient that you were worried about tuberculosis, let's say, where you would need the N95, you would wear it in there, you just discard it, you wouldn't even think about it. But now,
Right.
we're sanitizing masks and really saving it. The other thing, so I don't know if people know for the N95 mask, you can actually fail a fit test. So at my facility where I work, we wear, you get fit tested for that N95 mask. So what that means is there's an air leak around it. Then you have to wear the big PAPR, the big hooded.
Right.
Yeah, and that's I fail my fit test for a regular N95. So if I'm going into a high risk procedure like an intubation, I put on my full PAPRs, and that's called, the PAPRs with the big hood you'll see.
Right.
So for people that fail. And then there's also like what painters wear, the actual gas mask where you wear have the big
With the
thing. So
valves. Hmm.
with the valves, yeah. So I have that. I bring that with me to my ER shift because ER doctors, we have this mentality. We're kind of like always prepared for everything because you never know what's going to come in. So I bring that like kind of an emergency kit with me to every ER shift just in case all the PAPRs were being used or something, just so we would all be protected. The other thing I bring from home, which it's a good hack, is a poncho, a clear poncho. And when you're intubating someone, you put that over them. So it protects everyone in the room. And I did use that once and it worked really well. So I think I'm just so proud of like the medical community, nurses, physicians, respiratory therapists.
Absolutely.
Like everyone's been so creative and amazing with all of this.
Yeah. And so, has there been, so you've had experience then with some people coming in with respiratory symptoms. What is the protocol? Say if someone come in with a symptom, they're coughing, they're sneezing, maybe it's getting worse, it's not getting better. What is the protocol right now in the hospital for that?
So the thing about protocols throughout this whole COVID-19 is that they can change every hour, every day,
Yeah.
but they're always changing for the better. Where I work right now, we have a hot zone and then, which a possible COVID complaint goes to. And then we have a separate area for, say, a kid falls and gets a cut. So, I mean, it's just very impressive how we're working through everything. If someone does have complaints that we think they might be COVID positive, we all gown up. We don with our N95s with our equipment. Everyone also, if you're considering COVID as a diagnosis, there's a sheet and you write your name on it. Everyone in and out of the room. So if it was an actual positive test, everyone would be notified. So it's really about serving the patients and protecting our staff and the healthcare workers.
Right.
It's good. I mean, I'm very impressed with how Toledo in general is handling it.
I think that a lot of people still require, more information about, what the frontline workers are facing and how it's not just about us as an individual, but actually our part is really important in protecting others around us, right?
And the big thing is, like I said, it's changing all the time how many tests we have available and who we can test.
Right.
So someone comes in, but their vital signs look good and they're looking good, but they have this cough and they might be positive. We might not be able to test them. We might just say, right now you're safe to go home, but come back if anything changes. So, I know that can be frustrating and I know, we're trying to get more tests, things are changing. So
Right.
I think patience through all of this, because it's such a weird time is the best way to describe
Yeah.
it.
And there's been a lot of like on the news talk about mutations and new symptoms coming up. So in some ways you guys really have to be on the prepared end and kind of facing all of the emergency potentials, right? And in some ways that's the kind of spontaneous part of the job, I think, that is so difficult to prepare for.
Right. It's a lot to keep up on, especially when all this was new. I mean, I would spend hours at night just reading over all the cases, all the new journals, just to make sure I knew what I was talking about and it was evidence based, especially not only, all of my, friends ask me questions, family, and I want to be prepared. I also would do some urgent care telemedicine, when I wasn't working in the ER and I would get that was really hard to see because these people are at home. They're scared to go anywhere. And I had to send some of them to the ER because I'm worried about your breathing. And that was the hardest thing for me. And, talking about it to you is that what we don't realize is people are really suffering at home because they're scared to get help because they're scared of getting the virus. So that was emotionally kind of hard for me to see. And the anxiety and depression going on.
Yeah.
I spoke with a girl and she lived in an apartment by herself and she was struggling with anxiety and depression and it broke my heart because she lived alone in a city.
Right.
So I think that this is so complex. It's not just,
Physical.
stay
Yeah, it's not just
right.
physical.
It's not just physical. Oh my gosh, the mental implications of all of this. I think it's honestly being overlooked a little bit. I think we need to focus on, mental health moving forward, just because of all the everything, our economy, and the fear with all of this.
Right. And so in some ways, like you've turned pretty quickly to telemedicine, right? And using, information technology, using the internet to get some connection out there. I mean, as you said, it's not just physical, it's as much emotional and a sense of support from a greater community. And so you've been able to do that. I mean, can you maybe talk a little bit about what you were able to do from your end besides your important job as an ER doctor?
Yeah, so my passion, I love ER, but I am so passionate about integrative medicine. So it's an alternative medicine, evidence-based, more preventative. So I I've been really, turning to social media to help people, making informative videos on COVID-19, what's going on, what are some different things you can do at home, because I like to think of it as, we're kind of preparing for battle against this virus. So you want your
Mm-hmm.
best self, your best body to be ready to fight for it. Because honestly, I think we're all going to be exposed to this eventually. And like you said, it mentioned it does mutate. This
Yeah.
is, it's similar to the flu, that it's a virus that mutates. It's going to be different. It's going to change. It already has mutated. So we're going to see this. It's not just going to disappear one day. So I think preparing, what the focus should be on is knowing what you can do
Mm-hmm.
preventatively, keep your body healthy. What are the right supplements? Let's talk
Mm-hmm.
about gut health. So, it's been a real big passion of mine to create social media, to create posts, to give out information, because I don't think everyone just wants to hear, the negative news. I think the positive, and what can I do proactively? I think that is reassuring also.
Are there specific factors and conditions that make some people more vulnerable and some maybe comorbidity factors too that you're seeing?
By far, hypertension and diabetes are the top two that we're really seeing when they look at morbidity and mortality for this. And then, honestly, just today, a study came out from China, and the correlation with obesity is huge. And the pie chart, your risk of adverse effects and outcomes was like this with your BMI, your body mass index. So,
Oh,
but what comes with obesity? Insulin resistance, diabetes, blood pressure. So it makes sense to me. So when I see a study like that, I'm like, okay, come on, you guys. Let's let's cook at home. Let's not get fast food. Let's get healthy as a nation. And
right.
our death toll is going up and up, but our weight as a country has been going up and up.
Mm-hmm.
Okay, and that goes, with chemicals in our food and pesticides and toxins, and, instant gratification with food, and everything's fast. And so I think, I do an 80-20 rule. We cook at home 80% of the time. We still have treats. You're not depriving yourself. But for risk factors, obesity, diabetes, hypertension, and these are all chronic diseases and diseases of inflammation. So diseases that you just don't get overnight. Some people are more just genetically susceptible, but these are things that you can,
Pay
fix
attention
your,
to. Yes.
yeah, and help yourself. So, and you know, um, that's the really sad thing, is so many people that come into the emergency room, they're on diabetes medications, they're on high blood pressure. I mean, it's rare to see someone just on an aspirin a day. I mean, usually they're the healthy 90-year-old, grandmother that just had chest pain and is, lives by herself, but the more medications you have, the more risk you're going to be at for even just the regular flu. But SARS-2 or COVID-19, it's really hitting hard. Now, there are some cases of young people getting this, being on a ventilator, with no risk factors, or having prolonged hospital stays. But I don't want people to be scared by this,
Mm-hmm.
until we look at each one of those cases. Who knows if they had an inflammatory process going on in their
Right.
body? Who knows if their gut health was good, or if they were taking, over the counter Pepcid every day for
Mm-hmm.
acid reflux. So when people are healthy or no comorbidities, I question that, because I mean, we're just not living optimally in this country. We're all, I mean,
Right.
when it comes down to it, when I do an integrative medicine intake, someone, they say I'm healthy, but we discover lots of underlying issues. So
Right.
that's why if we live in fear about this, then that's going to cause stress and inflammation and hurt your immune system. So that's not helpful either. So I like to present facts, but not fear, because
Hmm.
that's just going to do more harm.
You're having both sides, both on the emergent medicine kind of end and the long term, like what you can do to bolster your body and what you should do to live a truly healthy lifestyle. Those two actually come together, So I think that's something that I'm hearing from you is that there are, it isn't random. Actually, there are some things that you can do right now. And so I wonder if you, like what you advise, the patients that you're seeing, besides just medicine, but there are some things that we do that do have a consequence in terms of our vulnerability to the virus.
Yeah. So other than the risk factors,
Right.
drinking alcohol decreases your immune function.
Wow.
So
I feel like a lot of
whenever,
people are doing that right now to get over the depression.
I know, and that is what hurts so bad,
Right.
like as a teen, because people are self-medicating. I hear the statistic alcohol sales have gone up, like 110%, and it breaks my heart. I mean, I'll have like one drink a week maybe,
Hmm.
or a glass of wine or something,
Hmm.
but even while I'm drinking, I'm like, oh, my immune function's going down. But sugar decreases your immune system for a couple hours after intake. So
Wow.
for me, I'm kind of odd, but when I go into an ER shift, I usually work night shift, but I do my vitamin C, my zinc, my quercetin. I do my whole botanical regimen, and then I fast while I'm at work. I don't eat any sugar. I just drink clean filtered water. I mean, you got to be smart when, and you can seek out this information, and this is why I try to teach people on social media, because I want the information to be out there for free and for them to be healthy. But yeah, things like alcohol and sugar, if you get sick, or if you're feeling sick, or if you're going into a high risk situation like an ER shift, or a gathering, once stuff starts lifting up, just be smart and just say, I'm going to boost my immune system, I'm just going to drink water. Just make smart choices. So those are some things, keeping that immune system strong, preparing it for battle, kind of like when someone prepares for a 5K or a marathon.
Hmm.
You're training. You're not just going to go out there and run it. You'll fail.
We didn't get to talk about this earlier, but I was just wondering maybe you can run through like your day to day. Like, what do you do to get prepared when you have to go to work at the hospital?
Yeah. So when I'm getting ready to go in, I kind of have a weird routine. So we all kind of go to work in our scrubs. Everyone's kind of doing this. We talked about it as an ER group. And then we change before we come home. So that's big.
Yes.
So I have like a bunch of like garbage bags. So I'll take a garbage bag. Like I look like I'm
Like
like
carrying.
on, yeah, like I have like a grocery bag, and I have my pumping, because I'm breastfeeding.
Mm.
So I have my pumping supply in there with the bag. And then I have like my little, emergency kit, like in case there's an intubation, with my mask, with with the, not the shower curtain, but that would work too,
Wow.
with the poncho. I have this Biocidin throat spray that if we intubate someone, I spray my throat and then I offer it to the nurses just in case we got some viral
Mm-hmm.
load, it would kill it. It's made from botanicals,
Mm.
but and then I have an extra pair of like glasses in there. So I have all that in my bag. And then if it's a day shift, I'm gonna pack food in a separate bag. And then I have a big thing of filtered water just to really stay hydrated. And what we all usually do is we're wearing masks the whole time, but then you just, you take it off, you chug your water, and then you put it back on. So then after the shift, I'm going to change out of my scrubs at the hospital, put on other clothes, and then go home. And then outside of my house, I take off my shoes and I leave them outside. And then I go straight to the laundry and I take off all my work clothes. And I've always had a separate laundry basket for my work clothes anyway, because
Mm-hmm.
there's MRSA, like it's gross. So I put them in the hamper, and then I go to my shower and I wash my whole body and I wash my hair. And then I go to bed if it's a night shift and I nurse the baby. But, I
Wow.
wash my hair unless I have a cap on. So sometimes I'll wear, one of those surgical caps,
Hmm.
and then I won't have to wash my hair. Because a lot of the people working full time, because right now I'm just part time in the ER, the women have been, their hair is a mess because they're washing it so much.
Right.
So, that's another thing you don't see. And then, if you're wearing the mask for 12 hours straight and you don't get a break to take it off, you're getting like, the welts there. So, I mean, there's a lot of things that are just different. So, and then in addition, I really make sure I'm taking vitamin C right before going in. I also take quercetin, which is a botanical, it's a zinc ionophore, so it helps zinc get into the cells to
Hmm.
fight viruses. So the bioflavonoid, so I take that. So I'm usually really on key with my supplements, but I take a little bit extra zinc and vitamin C for me before going into work. So, and then you come home, you make sure you get sleep, you make sure you try not to be stressed at work because that's bad for your immune system. So, it's been a little humbling, the whole experience, because you go into work and patients are like, thank you for your service or thanks for what you're doing. And I I've done this as long as I can remember in the ER, and I've always wanted to serve and help people and help patients. So I don't know. I personally, I think it's hard for me to take that in sometimes. I'm the person, I always, if I have a patient that has a Vietnam hat on or something,
Hmm.
I always say thanks for your service, and we talk about the war a little bit. And
Hmm.
so I don't know. It's a little hard for me sometimes to be called a frontline hero, honestly, because when I took my oath to be a doctor, I mean, that was when I gave my life to the profession, I guess. So I think it's great that nurses are getting, more recognition, and physicians, but this is what we love. I mean, as a physician, like I said, I took an oath. There's not many professions that do that.
Right.
So, I'm very grateful that I can serve in general, during this. I wouldn't change it for anything.
So, as maybe the last question for you, what advice would you give our viewers watching this, or even your viewers that you talk to on your platforms? What is the advice that you would want them to know, and what would you like to maybe see and hear from the community?
Well, I really just want everyone to live a healthy life and feel good. That's my passion. And you need to start with a good base, and that's nutrition. And a lot of people struggle with this. So there's the internet now where you can look up healthy ways to eat, different diets, whatever works for you, but
Yeah.
eat your vegetables. Eating vegetables, I mean, it's shown to decrease morbidity and mortality, study after study, time after time. And I think, try to notice if you're self coping with sugar or alcohol, because those two do, have a negative effect on your immune function. So if you
Yeah.
are in a place where you need help, go get it. Okay. There's online therapists. We're here in the ER. If any mental illness, I mean, there is no reason why you should stay home. No one will, we always in the ER, I open everyone with open arms. I mean, people are like, I feel bad for coming. I'm like, no, you're here because you need to be, and I'm here for you to talk to. So, I guess just I don't want anyone to struggle in silence. So going on with that, make sure you're taking good supplements, whether it's, you're getting vitamin C in oranges, or you're taking a supplement and zinc, quercetin, probiotics. Melatonin has been shown possibly to help against SARS. So, I mean, there's a bunch of different things. I do go into detail more on my platform with that. And then I know people are kind of upset about the whole wearing a mask thing. And so I just wanted to touch base on that. I wear a mask. I actually wear an N95 if I'm really close to people, because I could be an asymptomatic carrier, because I am healthy.
Yeah.
And this could affect me, and I could be in the hospital. We just don't know
Right.
enough yet. But wearing a mask is almost like an act of love. Okay. I think of wearing a mask is almost an act of love for those who can't or for those who are immunocompromised. So when I am not working in the ER and I'm out where I'm going to be in close proximity, or I'm going to like, or, talk, because you
Right.
can cough, talk. I wear an N95 because I do not want any of my particles getting to them. Or if you're just walking, at the farmer's market, just wear a cotton mask, have your kids wear one. Kids are coughing and sneezing and shooting those particles. So just tell them, there are people, and I think the one big group that we forget about are the people that get anxious when they wear a mask. It's not dangerous to wear a mask.
Hmm.
If you're over the age of 2, you can cool it off. But some people, they get really anxious. And I don't think we should shame people that don't wear a mask. We don't know. But just if you can and you're able to wear a mask, it's not about like, we're not getting into politics here. It's
Right.
literally showing an act of love,
Hmm.
and people get very heated about this.
Right.
And I'm not a big deal. It's just, we don't know enough about this virus, but we do know that it's weird because you're healthy for so long and you're asymptomatic, but your viral loads are high.
Exactly.
So I guess that would also be a good thing. One other thing would be get outside, walk,
Very
be in
good.
nature.
Yep.
So exercise, just walking around in nature, being in nature, putting your feet in the grass, grounding, meditation. I mean, that's the one thing that I wish I could get everyone to do, okay? It's really, especially in these times right now of uncertainty. So
Right.
meditation would be something that just try it out.
Yeah, well, thank you so much. I mean, I think those are really great tips. And I think it's even more important that you added that note about the masks because that is a huge point of contention as we
Yeah.
speak. And I think you're right. I totally agree that it's not about politics. And it's just something that, as we've been talking about this entire episode, it's our bodies. We're all humans and we all have a biological immune system that needs to be taken care of. And there are certain things that like wearing masks, that is basically proven that it will reduce how much we can spread and how much the virus will be contagious in our own community. So I think you're right. It is an act of love that we hope to be sharing with the community. And thank you so much for your time. And again, I know you might not want to hear it, but thank you for your service as we really truly are beneficiary in this community for not just the service and the skills but also the information that we hope to be spreading. So
Thank you so much for having me. It was so nice talking to you, and I had a good time.
awesome. Thank you, doctor. Thank you for tuning in, and I hope you got something new from today's episode. As we learned, the toll of the pandemic is as much mental as it is physical. We also heard just how important it is to show an act of love toward fellow citizens through mask wearing. This time may be difficult, but it can very well be an urgent call for us to get on a healthier and more conscientious track for the future of our country. If you enjoyed this conversation, like, subscribe, and share our content. As always, stay safe, stay healthy, which may mean eating more vegetables, and stay human.